in our research ambassador community. So we're thrilled to have you here today to learn about this important work and to see how what a great time it is now that we have optimism that things have changed due to this research. And I'm going to tell you a little bit about it before we get into talking with our research ambassadors about their experience in research and how they felt about helping us move forward with the science. So the things that we're going to talk a little bit about today, and all of these could be a topic in their own right for a full discussion, but we're just going to briefly go through this just to let everybody know the status of things at the moment. And you'll have these slides to reference, and this will also be recorded for you to reference. So we're going to talk about advances in diagnosis and understanding changes that have occurring in the brain when people are dealing with dementia, finding purpose through research advocacy and community engagement. So our research ambassadors are going to talk to you about that. We're going to talk about prevention research and how we're accelerating the research process. We're going to talk about the new treatments currently available that have been around for the last few years and treatments that are in research currently. We're going to talk about what we can do now to help delay the onset of brain disease and how to access information and resources at Mass General Brigham. So we have learned so much through research and through all the work of all the scientists and all the researchers across Mass General Brigham and all the other ADRCs and research sites about what is happening in the brain. And today we're going to talk a little bit about the medications that are affecting those plaques that misfold the amyloid and the tau proteins. And we're also going to talk about some of the things that happen in the brain that we can control, like stress and vascular disease, and how we can do things to actively maintain brain health. So, one of the things that's happened in research over the past 2 decades, and a lot of this work has been done here at Mass General Brigham with the Harvard Aging Brain Study and at the Martino Center, is that we can actually see what happens in the brain now through very sophisticated imaging. We can see what those misfolding amyloid proteins that are building up, and we can see those tau proteins in the brain. And we can do that through two different types of tests, a PET scan, a positive emissions tomography, and an MRI scan, a magnetic resonance imaging scan. We can also measure the amount of amyloid and tau in the cerebral spinal fluid, which tells us if somebody's susceptible or has Alzheimer's disease. So it shows up in the cerebral spinal fluid if they have a decreased amount of amyloid, and it shows up as an elevation in tau. So these are ways we know what's happening. And here's a picture that shows you over here to the left, you can see somebody who's not yet showing symptoms, and up here is the amyloid buildup, somebody who's got symptoms and is more advanced, and down here you can see that with the tau progression. So that is a wonderful thing that we know and we can monitor people, but it's getting better. I mean, this is the good news. We now have blood tests, and we're on the cusp of really introducing these into the clinic setting that show us how much amyloid and tau people have in the brain. And as these biomarkers get easier and the technology improves, we're going to be able to get people evaluated and diagnosed so much more quickly. And another thing that we can really be proud of here at Mass General Brigham is our leaders like Doreen Rentz and Kate Papp and Rebecca Amarillo have been working now for several years on these new measures to evaluate cognitive ability and do tests so people don't have to have a full day battery of this testing. And this too is soon to come into the clinical setting. Right now, this is being done in research. And they're going to be able to look at testing on iPads and iPhones and you'll be able to do your testing at home and send it in to your doctor eventually. And this is going to be implemented into clinics probably in the next few years. And this is a very exciting time. So, for those of you who have family at home who are concerned about somebody experiencing memory and thinking changes, and you want more information about diagnosis, we have that information on the Magic website and would like to share that with you. And I've listed some websites here where you can get additional information, and we'll make this available to you after today's presentation. But our research ambassadors and our research participants now who are on studies out there, they're our heroes because they have brought us so much hope, and they have led a new era in treatment. So it used to be that treatment only worked for disease side effects. So it's changed side effect management of the disease, but it really didn't change the pathology of the disease. And that's where we're at today. So we have new medications. They've been around now for a couple of years, so we've learned a lot more about them. The clinicians in the clinic at Mass General Brigham are working really hard. There's several people on treatment. I believe we're the biggest treatment center in the United States. And the names of these medications are lecanemab and donanemab, and they're infusion medications. The lecanemab is also available now through subcutaneous, and they're given in the clinic, and they're very closely monitored. They do have serious side effects, and that's why they are closely monitored. Because as you know, in your brain, when you have this buildup of amyloid and tau, these medications actually remove the amyloid from the brain, and when it does, it causes these micro hemorrhages and these amyloid-related imaging abnormalities called ARIA. So these are two medications. The main difference is that they affect the plaque a little bit differently. The donanemab affects more mature amyloid plaques, where the lecanemab affects those plaques earlier in the process. So the Alzheimer's Therapeutic Clinic here at Mass General Brigham, people are referred through the neurologist or through their primary care doctor. And the website's here if you'd like to learn more information about it. And these medications, as a reminder, are for people with early disease or mild cognitive impairment, not people who've been living with this disease for many years. Um, the other thing to be really excited about, and again, the only reason why we're here is because of the people who've participated in research studies, is we have over 495 active NIH studies going on right now, looking at different things like targeting tau proteins, neuroinflammation, and other metabolic improvements. But still, the biggest barrier we have is having people participate in our research studies. So some of the new treatments that we're really excited about that are coming down the pike are looking at these treatments to remove amyloid, but in new ways. So maybe in a tablet pill formation. So keeping the amyloid from becoming harmful, protecting those brain cells and improving brain cell function. And also looking at slowing down the spread of tau in the brain, and treatments that will reduce inflammation and calm the brain's immune system to protect brain cells over time, and using existing medications already on the market in new ways. And I think one of the most exciting areas that are happening, and another reason to be proud of the work at our institution, is that these medications are being used earlier in the preclinical symptoms of the disease, before people are showing symptoms, before they are progressing to mild cognitive impairment and to dementia. So these are being done very early, and this is the work of Dr. Risa Sperling and her team. Many of these studies have already started, and the Center for Alzheimer's Research and Treatment has been doing some of these studies, and some of the research ambassadors that you're going to talk with today have been part of some of these early studies. So it's a very exciting time. And, you know, we know we have to do this work because we know that people are at a high risk for Alzheimer's disease early on before they develop symptoms. And, so to delay this memory loss and to prevent cognitive decline, we have to be on it earlier. One way we can do this is by monitoring, and the Alzheimer's prevention web study does just that. So we have a web-based study for people who are concerned or feel like they might be at risk, and they can have free online monitoring every 3 months. I've put the website here. And should you have changes, you'll be connected to a center. The center regional to us here at Mass General Brigham is the Brigham Center, and you'll be offered opportunities to get evaluation and to participate in research if you'd like to do that. So we also have a way for people to get engaged in research for anybody over the age of 18 who's worried about Alzheimer's disease and related dementia, or who has a family history, or they're caregiving for somebody with dementia. We have all different types of studies: treatment studies, prevention studies, caregiving studies, imaging, monitoring studies. And if people are interested and want to learn more, they can sign up, and somebody from our team will reach out, get in touch with them, and help them get information about this work. So I don't know about you, but this is where I want to be, and I'm sure many of us do. We want to be healthy, living a great life, and we know we can do this now because we know heart health is linked to brain health, and we can stay healthier longer if we do some things. And some of those things have been proven by research, and our research participants have been in these studies and making that happen. So we know something as simple as walking 3,000 steps a day, eating a healthy diet, staying cognitively engaged, staying active in your community, limiting your alcohol, maintaining your weight, monitoring your blood pressure, and getting hearing aids all make a difference. So if we're doing that, we're helping. So you can see it's really a time for hope and optimism. And as a review, just remember we have approved treatments that are actually slowing down cognitive decline now, that are changing the pathology of the disease. We have many novel new medications in research. Many of these are going on to bigger phase studies that will look at approval. And research has shown us that simple strategies can make a difference for brain health. So please look at our website at www.madrick.org. There's lots of great resources there for you. Our research ambassadors has helped create a lot of this information. There's also national resources that you can send to friends, or if you're not from this area, that you can get in touch with. And now I'm going to turn it over to one of my research ambassador friends, Joe Costello, who is going to tell you about the Research Ambassador Program. And all of our research ambassadors will be answering a question about how researchers impact their life. And during that process, they'll also be introducing themselves. So we're going to proceed to this section of the program. Joe, I'm going to hit stop share so we can move on to you, okay?
Okay. I'm Joe Costello. I'm one of the earlier participants in the Research Ambassador Program. I joined at the encouragement of Dennis Chan, who's here on our panel today, who was there at the group's creation. Thank you, Dennis, for that. As far back as 2015, the Outreach, Recruitment, and Engagement Group at our Alzheimer's Disease Research Center, MADRIC, was developing and promoting the concept of research ambassadorship. That was a pretty novel idea in dementia research in 2015. By 2017, our research ambassador group had really begun to take shape. Our original purpose was straightforward: to give others an insider's look at participation in dementia research. That assignment involved explaining our experience to community groups that were assembled by Madrick staff. To do that, we had to overcome the natural human reluctance to talk publicly about personal things. Things like our dementia status, our fears, our uncertainties. Gradually, we learned to tell our stories in ways that people considering research participation seemed to find valuable and even reassuring. As we did that work, though, something important happened. We realized that what we were learning by taking part in studies had value beyond recruitment. Between our own experience and the information researchers shared with us, we were learning about a whole range of things. These included research design and operation, caregiving, coping with uncertainty, and living with dementia over time. We were accumulating distinctive knowledge that we could pass along to others. And that realization expanded our program. In addition to joining Madrick professionals at their community meetings and webinars, we began organizing our own education programs. These featured leaders in dementia research discussing both their own specialties and the broader state of the field. We followed a year-long series of those didactic presentations with what we called Talk with the Doc sessions. These sessions created direct conversations between researchers and the public. Over time, our research ambassador program became connected to the broader dementia research and advocacy networks. MGB's research ambassador model has been presented at national and international meetings, and many ambassadors have become involved in additional work focused on advancing several things. These include dementia research, of course, patient and care partner support, and dementia-related public policy. Plus, for most of us, the Madrick Research Ambassador Group has become much more than a volunteer activity. For us, it's become an energy source, a home base, really a kind of dementia family. So thank you, Lenore, for creating and managing this, and thanks for giving me this chance to talk about it.
Thank you, Joe. So we're going to start with some questions, and you're going to meet some of our other research ambassadors. So Eva, thank you so much for joining and being part of today. How has dementia touched your life, and how do you stay healthy to prevent cognitive decline?
Hi, good afternoon. My name is Eva Santos. I am assistant engineer, now retired. I am volunteer here in Boston, Latino Aging Studies. I got in this study because I suggested an invitation of my neurologist. And later, I got in the Madrick because a dear friend of mine began to lose her memory. And that fact hit me hard. And I began to learn more about the disease because it was a clear signal that anybody can get in problems with the memory. How I keep my brain healthy? Well, I am following the suggestion and instruction of the researchers. That means I stay physically active, try to move as much as I can every day. I follow a brain healthy diet. We, in general, because of my culture, we try to eat very natural food, a lot of vegetable fruits. Here, there is a treasure called blueberries that is wonderful for your brain health. Um, try to control the intake of alcohol, for example. We don't smoke. That is a way to protect our brain health. And other part is to try to learn every little thing every day or most of the time. So right now I am learning artificial intelligence, how to make fashion jewelry, how to find new techniques to solve Sudoku puzzle, and reading and get engaged with a lot of new stuff, especially in the kitchen. And learning recipes every day to try to get the same types of ingredients, but in a different way to stay in our perfect diet. Try to get my connection because of my activities. I am an activist in my community. I am a pro-democracy activist. I am a volunteer of the Venezuelan Association of Massachusetts. I am Venezuelan, and that keeps me very active socially, emotionally, and mentally.
Well, thank you, Eva. That's fabulous. We appreciate everything that you're doing. And we have we're going to have time, hopefully at the end, that we can ask more questions. So, Rick, I'm going to go to you next. And as well as introducing yourself, can you tell us, as a person living with cognitive changes, how has research been part of your journey?
Sure. Hi, I'm Rick. I'm a retired software engineer, which means I'm very analytical in the way that I think. So here are a few tidbits of my personal history to help you understand kind of who I am. My father was a doctor, so helping others was instilled in me at a very early age. My younger sister spent most of her career in the research lab studying neurodegenerative diseases, including Alzheimer's. So with both a doctor and a researcher in my immediate family, my trust in those communities is really, really strong. My dad passed 19 years ago, and he was confirmed to have frontotemporal dementia. My mom passed 9 years ago and was confirmed to have Alzheimer's. The long-term care for them really was an ongoing family effort combined with a lot of advanced planning by my parents. With both parents having passed with dementia, clearly I've got an issue with some risk from genetic factors. I'm early in my own progression down this path as I'm undergoing my own initial evaluation for MCI, mild cognitive impairment. I've been participating in the APT web study, which Lenore mentioned earlier, for 4 years. She kind of covered what this study was about. It basically is online testing that is very easy to take, and you collect your scores over time, and you can see your, if there are changes. Through the APT web study, I learned about a clinical drug trial, which I've now been participating in for 3 years, and I've got one more year to go. And actually, two of my sisters are also in that very same trial. My participation in research has been a really important part of my journey in a couple of different ways. First, to honor my parents. My dad really lamented the lack of effective dementia treatments while he was alive. My participation in this research will help improve access to effective dementia monitoring and treatment in the very near future. And I think it's really important to stress that the future is almost here. We're always improving, but the results are really starting to bear fruit. Specifically, I mean, for myself, I may actually benefit from the new medications myself. Secondly, I've been able to learn about dementia by associating with people who are very knowledgeable in this area. They've shared their knowledge, they've pointed me towards great sources of information, as well as being personally supportive of my journey. And that extends to the Research Ambassador Group in particular. My participation in research has also been very helpful by introducing me to some great doctors in Boston. This has enabled me to assemble a top-notch personal medical team. And even more important, I learned when I needed to expand my primary care team to include neurology and other fields. About study safety, I've got a very high regard for the serious way that my study team approaches participant safety. They're constantly double checking things to be sure the study protocols are being followed and that they're administering the right drugs to the right people. They make sure that I'm aware of any limitations related to the study, such as how to schedule vaccinations around my study visits. I get infusions every 2 weeks, and so I have to be a little bit careful about certain things. So they're very good about that sort of thing. My study does have a very small, less than 1% incidence of a very serious side effect. So early in the study, when I commented about a minor headache, I was quickly scheduled for an extra MRI to confirm that I was not in the early stages of that particular side effect. The study itself is structured with many tests and scans to constantly monitor participants and with their safety in mind. While we can't eliminate the risks of testing new drugs, the study team certainly has done their very best to reduce those risks as much as possible and to actively monitor participants so we can immediately respond to anything concerning. I'd also like to point out that all of us face risks every day. Just walking down the street or driving your car to the grocery store does expose us to some level of risk. We generally accept that risk with very little thought, but that does not eliminate the risk. The difference with research study is that we're consciously considering a new risk and determining for ourselves if that small personal risk is worth the greater benefit to society. For myself, the answer is absolutely yes. Lenore?
Thank you, Rick. That was so insightful, and we appreciate it. I'm going to call on Phil next, and he's going to also introduce himself. But I have a question for Phil. Phil, as a caregiver and a study participant, how did you balance these responsibilities and over a very long time? And what benefits do you feel you derived personally from participating in research?
Yeah, thank you, Lenore. Appreciate the question, and I'll try and answer it to the best I can. And thank you all for outsiders for this being participation in this community today. I think you'll find it worthwhile. My name is Phil. I live in Plymouth, so-called America's hometown. I had a great set of role models, parents, both members of the greatest generation. When it came time, they both donated their bodies to science. So in a way, they were my heroes. So to answer Lenore's question specifically, I actually had a relatively short period of time when my involvement as a study participant overlapped with becoming a care partner. I use the term care partner, not caregiver, because I believe between my wife and myself, it's very mutual. It's not all one-sided. There were subtle changes going on, which I thought were isolated events in my wife. I was wrong, and I'll explain. So I'm honored to be among the members of this panel today. I consider them to be heroes and pioneers, actually, in this kind of a study. I, like Joe and Dennis, you will hear from, was in the A4 clinical trial. It's an anti-amyloid-based program. My run was about 7.5 years until it was terminated. My dear wife and my study partner was my study partner throughout. That meant she had official capacity to observe and criticize my cognitive well-being and day-to-day behavior. And I say with a smile on my face that she certainly did, as far as criticize goes. I became a member of a special caring and supportive community of other study participants, some of which are right here in front of you. Usually infusions for me and for the A4 study was about once a month. And I actually look forward to those appointments in spite of trekking into Boston. I became a part of the community, and I was sad when the study ended. It became, for 7.5 years, it was part of my self-identity, and I actually missed it when it was over. It left a void. It's hard to explain, but the people I met, some on the panel, and the people in the Center for Alzheimer's Research and Treatment were just fantastic people. So afterwards, when the study ended, I continued to contribute as a research ambassador like this. And come on, where else could I be called an ambassador but a place like this? So as time went on, my wife exhibited cognitive challenges on top of serious existing health issues. They were subtle at first, then more significant, overlaid with behavioral changes. Fast forwarding to today, because of time constraints, she now lives in a skilled nursing facility. Dementia has forever altered our lives and that of our children and grandchildren. So it has a ripple effect. But I have learned a significant amount about Alzheimer's and Parkinson's disease and other dementias. I can understand better these challenges because of having been a member of the research community. I have found a wonderful support group on Cape Cod. I'm going to give them a public plug, the Alzheimer's Family Support Center, AFSC, in Brewster, Massachusetts. I'm fortunate enough to attend meetings twice a month and participate in other support communities. It's really cathartic to have a group of people like you to talk to. Today, I consider myself a work in progress. I'm constantly trying to improve as a care partner. And I admit sometimes I fall short, sometimes big time. One final thought. If you know someone who has a loved one afflicted with dementia of any type, they are navigating terribly turbulent waters. Don't turn away. Don't disengage. Don't avoid. Instead, offer some acknowledgement and means of support. It's greatly appreciated, more than you can imagine. I look forward to your questions, and back to you, Lenore. Thank you very much.
Thank you, Phil. That was fantastic. We appreciate your thoughts. I'm going to ask Joe to return to us next, and I have a question for him. He's been very involved in this, so I want to learn more. So, Joe, how has advocacy been part of your journey, and how do you feel it's impacted you, who's somebody who's, been concerned about this disease and a former study participant?
Well, I would answer it this way, Lenore. By profession, I'm an organizational consultant, but over time, dementia advocacy has largely taken over my schedule and my life. My run into this work began when I enrolled in an Alzheimer's prevention study, the A4 study that Phil was referring to, at Brigham and Women's Hospital in 2014, right at the beginning of that study. Over 8 years in the study, as a research participant, I had a close-up view not only of research and practice, but also of the effect that dementia has on patients, families, care partners, healthcare systems, and public policy. Dr. Gad Marshall, who is the principal investigator for the A4 study at the Brigham, introduced me to people in Massachusetts state government who are trying to address the growing dementia crisis. Through that work, I became involved with the Massachusetts Alzheimer's Advisory Council. That immersed me in the realities of dementia care, caregiving, and the system's challenges that are associated with those. What became impossible for me to ignore was this. Despite the enormous and completely warranted investment in developing new dementia treatments, too little attention was and is being paid to supporting people living with dementia and their care partners over the long course of the disease. Having once seen this close up, I could not look away from it. The knowledge and motivation that came from participating in research, combined with what I learned from researchers, policymakers, patients, and care partners, and combined with my own background in organizational psychology, gradually evolved into what is now more than full-time volunteer advocacy. Even after moving from Cambridge to Oregon in 2023 to be closer to family and friends, I remain deeply involved in work with dementia policymaking in both states. I feel extremely fortunate that participation in research, and especially the Research Ambassador Program at Mass General Brigham, opened the door to the most meaningful work I've ever done. Lenore?
Thank you, Joe, and thank you for all you do in the advocacy space. We really appreciate it. So my last question is for Dennis, and Dennis, you'll be introducing yourself as well. But Dennis, what would you tell the community members here today considering research participation? What words of wisdom do you have? You-
Unmute myself.
Thank you.
Okay. Well, I'm Dennis. I'm a retired software engineer who is living with mild cognitive impairment. Well, you might say I'm an accidental study participant because I signed up for my first clinical trial to support my wife, who has a family history of Alzheimer's. But during the screening, I found out I had an elevated amount of amyloid, even though I had no symptoms at the time. So over the past, well, I guess when you're having fun, doing meaningful things, time flies. So it has been over a decade. I've taken part in many research studies in Mass General and Brigham. So I was very fortunate to discover my Alzheimer's risk early on, which gave me time to learn more about the disease, make some lifestyle changes to slow it down, and plan for the possibility of progressing to more serious stages of dementia. So participating in research studies allowed me to connect with experts in the field and also meet other participants who are in similar situations. It also led us, that's me and my wife, to an extensive support network. As you heard from Rick, modern clinical trials are generally safe because the safeguards are in place to protect the rights, safety, and welfare of participants. And using myself as an example, when I was taking anticoagulant for AFib, which disqualified me from participating in an anti-amyloid drug trial, because the anticoagulant put me at risk of serious complications. Since I participate in so many researches, I can say that different research studies require different commitments. I was in a clinical trial that lasted many, many years with monthly infusion. And then I have also been in a wearable device study where they bring the device to my house and did all the tests in one visit. So there's a great variety of researches that are going on. Also, I have found that study teams are generally very accommodating if I need to change my appointment for whatever reasons. Since there are so many research studies happening in MGB, it's pretty easy to find one that fits and that you feel right about. And if you don't find the perfect study, there are always others out there that might be a better fit. So here's a quick rundown. Early detection and diagnosis are very important. Don't be shy about it. Joining research studies can be a great way to be in contact with experts and also contribute to science at the same time. Research studies are designed to be safe, and you shouldn't have any problem finding a study that interests you and feels comfortable. If one study doesn't work out, there are always others looking for participants, either now or in the future. So I hope this helps. I look forward to the Q&A. You know?
Thank you. Thank you, Dennis. And thank you to you and Angie for all the research participation that you've done and how you've helped us. You're all my heroes. You all know that, right? You're all amazing. So I so value that you came today to talk to the this group that's attended today in the community. So we're going to open this up for questions. So if anybody, we're going to stop recording.